Alrighty. Hello. My name is Luann Lonergan, and I'll be your registered nurse today. Can you show me your armband and tell me your name?
My name is Joan Smith.
Wonderful. And can you tell me your birth date?
Yeah, September 3rd, 1942.
Wonderful. Alrighty, well, what we're going to do today, the surgeon has asked that I change your dressing, and I just want to make sure, this is your first surgical dressing change, and I just wanted to make sure, are you feeling any pain right now, or how is your comfort level on a scale of 0 to 10, 0 being no pain and 10 being the worst pain? Where's your pain right now?
It's not too bad. I had a pain pill about an hour ago, so I would say it's about a 2.
Wonderful. Okay, and I looked at the record, and it looks like all your vital signs are okay, your temperature's okay, so I'm just going to wash off the table here, get a few of my supplies ready, and we'll be ready to go, okay?
Okay.
Wonderful. Alrighty, so I'm just going to lift this up a little bit, and I'm going to wash off the table. How was your night, Mrs. Smith?
Oh, I slept kind of on and off.
Okay.
It'll be nice to go home and get in my own bed.
Yep, that's a good place to be. So again, the surgeon has asked us to do that dressing change today, and I'm just going to take a peek at it, make sure everything looks okay. Alrighty, so I'm going to just wash my hands again here and put on some gloves. And really what I'm going to, when I take a peek here at that dressing, I'm going to just lift up your bath blanket and your gown, and I see a little shadowing here. So there's a little bit of old dry blood, and that's not uncommon for that first dressing change. So because that exudate could be pourable, drippable, squeezable, or flakeable, I'm going to use a red bag. Most of the time I can use a non-biohazard bag for just the regular garbage, but because there could be potential of pourable, drippable, squeezable, I'm going to have a biohazard bag here.
Okay.
Alrighty. So the first thing I'm going to do is I'm just going to take off this dressing and let me know if anything is pulling. I'm going to hold down here and I'm going to pull towards the wound. How does that feel?
That's okay.
Alrighty.
The tape is really sticky.
It's a little bit sticky, so I'm just going to pull up a bit, kind of make sure I'm getting all of the wound edges or the tape edges up. Okay.
You sure put a lot of tape on.
They sure do. Alrighty, we're almost ready here. Alright, what I'm going to do is I'm just going to lift up over here. Looks real good. I see some serosanguinous exudate, and it's contained in the dressing, and it looks about 5 to 6 centimeters in diameter. So I'm going to just push this over here, and then I'm going to pick up the other two, and those are saturated, and those have some dried and a little bit of, moist sanguinous drainage. So I'm going to put those right in that biohazard. And then I've got one more. Just a little bit of old dry bloody drainage on there. Wonderful. How are you doing, Mrs. Smith?
I'm good.
Very good. Looks like those edges are well approximated. The staples are intact. Looks like there's a little erythema around that wound, a little bit of redness, but I don't see any edema. There's no odor, and I've got a nice JP drain here, and it looks like they just emptied it, and it is got some suction going, so everything looks real good. So I'm going to get my supplies ready, okay?
Okay.
All right, you're doing just fine. So I want to just check, Mrs. Smith, do you have any allergies that you know of?
No, I'm not allergic to anything.
Okay, we're going to use a little bit of chlorhexidine on that, the skin surrounding the incision. So that's what I'm going to use here. So the first thing that I'm going to do is get that ready. I'm taking a peek here. Expiration, we're within real good expiration. And I'm going to tear off some tape so I can tape that to the bedside table. All right, so I'm going to open that up. Being careful now not to touch those sticks, because when I touch those sticks next, I will have some sterile gloves on. So I'm going to tape this right to the bedside table. All right. Then I'm going to tear off a couple of pieces. Since I did wash off that bed, or excuse me, the bedside table, I'm going to tear some tape that I'll use to tape down those dressings later. And I've got that all set to go. Okay, now what I'm going to do is I'm going to lay out, I've got already my my dressings, I've already got them the way that they're going to go onto those wounds. So the first one will be the drain sponge, and I'm taking a peek at the expiration date. Looks good. So I'm going to stay right off to the side here, and I'm going to open up that dressing. Holding on tight here, and I'm going to open that up. Looks very good. Okay, the next one will be a 4x4 gauze sponge, and again, it's got a nice expiration date, and I'm going to hold this, being careful not to reach over the drainage sponge, and I'm going to open it up on a flat surface. Alrighty, looks very good. And then the last dressing will be the ABD, and that looks like it's got a real good expiration date. The ABD, or abdominal dressing, which is a little bit bigger. That's going to cover the other dressings. Very good. Now the last thing that I'm going to do now is get on my sterile gloves. So I've got a size that I've already sized myself. I'm a size 7.5, and it looks like we've got some real good expiration date here. So I'm going to open up the outer package and set those gloves down. Very good. Now I'm going to come off to the side and open up those sterile gloves and pull down the edges here, being careful not to reach over any other part of those dressings. And I'm right-handed, so I'm going to grab that right glove first, and I'm going to step back while I put it on. I'm going to slide it on. Beautiful. Alrighty, now I'm going to pick it up underneath. I'm going to put my 4 fingers underneath the cuff and pull back, and I've got my thumb abducted, and I'm going to slide that right on. Beautiful. Very good. Now I'm going to come on over here. How are you doing, Mrs. Smith?
I'm okay.
Wonderful. So the first thing I'm going to do is I'm going to take one of the swabs, the chlorhexidine, and I'm going to start scrubbing the skin surrounding the wound. And we're going to go for 30 seconds back and forth, not over the wound, but the skin surrounding the wound. And then I'm going to turn it over for the next 15 seconds. So it's a total of 30 seconds back and forth. That friction is really what's cleaning the skin surrounding the wound. And then I'm going to drop it, and I'm going to take that second swab stick, and I'm going to go on the other side of the wound for 30 seconds. Back and forth, back and forth. Beautiful. I'm going to try not to go over the wound, but just on the skin surrounding the wound. Back and forth, and I'm making note that those edges look very approximated. They're closed tightly. There's no redness, or just a touch of redness, but there's no edema on there. Now the last one I'm going to do, I'm going to have to pick up this drainage sponge. So I'm contaminating my left hand, and that's okay. I'm going to go around the drain site, back and forth, careful not to go over what I just cleaned, for 30 seconds. Turn it around and get this other side here. Beautiful. I'm going to let that dry for about 30 seconds. How are you doing, Mrs. Smith?
Oh, that stuff was a little cold.
Little cold, yep. And I'm just letting it dry before I put on those drainage sponges. So I'm going to take that one now. We're going to take that right here, and we're going to put that right on the wound, right by the drain. Now I'm going to take the other two, and I can pick that one up and pick that one up and go here. Beautiful. And now I can take my ABD, and since I'm going to just touch on the outside of it, I can put this right down. Very good. And now I've got my tape pulled, and I can picture frame that. Does that feel comfortable, Mrs. Smith?
Mm-hmm.
Okay, you're doing real good. That wound looks real good. Again, those staples look intact. The edges are closed tightly, or that's another word, is approximated. And the drain is functioning properly, so everything is right where it needs to be.
Good. I hope it heals up good.
Okay, so I can either pin this JP drain to the gown or let it off to the side. So that's what I'm going to do right now. Cover you up, and I'm going to want to make sure that you've got your call bell within reach. That should be good here. I'm going to throw away some of these other things. Real good. I'm going to just wash my hands one more time. Then I'm going to just tie up this bag, and I'll take that out to the biohazard waste where that is contained outside the room. And I'm going to just make sure that the bed is in low position before I leave. Okay. Do you have any other questions or concerns, Mrs. Smith?
No.
Okay, everything looked real good. So you've got your call bell, and just call if you need anything.